And now thousands infected and dozens dead in Florida's 2-year-long hepatitis A outbreak. But state health officials are still keeping the public in the dark when it comes to epidemics, even with new fears about the coronavirus. So I went to the state capitol to get answers. After thousands of hepatitis A cases and dozens of deaths in Florida, the health department still refuses to tell the public where Hep A cases are happening. Even after a dirty dining investigation uncovered restaurant workers testing positive for hepatitis A. But local health officials telling us they can keep it all a secret because this state statute says information on major diseases is made public only when necessary to public health.
And it seems like it may be undermining public health and safety.
Attorney Frank Lomonti, a University of Florida professor whose teaching focuses on the Freedom of Information Act, says that kind of secrecy is not supposed to be happening in Florida.
Then you have an agency that seems like it's putting a thumb on the scale in favor of secrecy when the Florida Supreme Court has told us over and over again that the thumb is always supposed to be on the scale in favor of disclosure.
But Hillsborough's health department only released the name of very few restaurants.
Because the other ones did not have, in our, investigation, conditions have warranted or put the public at risk.
Even as the county's top doctor admitted it was a health crisis. But you yourself called it an epidemic.
It is.
And Pinellas County also wouldn't say which restaurants had infected workers. But there's no one to speak on camera about what you're doing to protect the people of Pinellas?
People rightly look to the public health department to inform them about whether there might be something that puts their health at risk. The buck stops with them, and it's disappointing if they're passing the buck. I spent more than a year calling and emailing, but the health department refused to tell me where people were infected or dying of hepatitis A. So I came here to the state capitol to find out why it's being kept such a secret from you, the public. I went to the state health department in Tallahassee to get answers from the Surgeon General. I've been trying to get an appointment with him for almost...
You can see he's very busy. I mean, what else can I do?
State Senator Darrell Roussan, who represents Hillsborough and Pinellas counties, both hit with high numbers of hepatitis A cases, says information can save lives.
If a person is given information that they seek that might help them stay healthy, avoid death, avoid dire consequences of hepatitis A virus, why shouldn't they be given that information?
Roussan questioned Surgeon General Scott Rivkees at a hearing earlier this month.
When do you think it's necessary that the public be made aware?
If it appears that a patron notification is needed, then that will be issued.
But exactly how often is the state notifying the public?
Only about 20% of situations where a food service worker has hepatitis A has resulted in a patron notification.
That's right. Dr. Rivkees told lawmakers the public was only told about 20% of infected restaurant workers. And we wanted to know why. Why haven't you released information about the deaths of hepatitis A? There were over 50 people who died of hepatitis A.
Nobody has any questions.
And why haven't you released more information about the restaurants? You said only 20% of the cases were public. Why haven't you released more? It was an epidemic. Hepatitis A was an epidemic in our state. Why are you keeping so many cases a secret? There were 56 people who died in Florida. Why aren't you answering any questions about where they got the hepatitis A infection? Doctor, please answer some of these questions. Doesn't the public have the right to know? Doctor, doesn't the public have the right to know? Dr. Rivkees, please, doesn't the public have a right to know hepatitis A was an epidemic in our area?
You're not allowed back here.
Why won't he answer our questions?
I have a meeting with him. You need to wait out here. He'll come back out.
Well, I think that's really a shame that he won't even talk, especially when the public is at risk. And with fears over the coronavirus, we wanted to find out what the state is doing to protect the public from an epidemic.
Clearly, hepatitis A is a concern.
Over the past year, Lieutenant Governor Jeanette Nunez announcing numerous meetings and phone calls with Dr. Rivkees in their fight against hepatitis A. But when we asked for emails, text messages, and phone call transcripts between the leaders to back up this claim, a state spokesman told us there are no records responsive to your request.
request.
The default should always be more disclosure and not less.
Lomonte also has a message for the health department.
Your information is the most reliable. Yours is the best quality. You can actually help to dispel rumors. You can serve a really valuable rumor control function if you'll be forthcoming and transparent.
Meanwhile, the Surgeon General never came out to answer our questions. That might be because he's busy holding 3 other jobs, all while being in charge of the health of our state. He works as a University of Florida professor, a doctor at a Gainesville hospital, and a medical researcher. He makes more than $500,000 a year in those jobs, and you, the taxpayer, foot the bill.